Hi mums and dads, I'm Dr Nelu. I'm a paediatric doctor and I'm here to chat about children's health. On today's episode of Kids Health, we'll talk about introducing foods to your little ones for the first time. I'll chat to Dr Preeya Alexander, the Wholesome Doctor, about healthy eating in kids. We'll explain the world of allergies and some tips for dealing with them. And I'll be asking gorgeous 4-year-old Ravindra all about his favourite foods. Introducing foods to your child can be a very exciting or stressful time. Parents have a lot of questions around this. Question number 1, when can I introduce food to my child? Now the recommendation is usually around 6 months of age, but not before 4 months. So generally any time from 4 to 6 months should be okay, but it depends on a few things. The main thing to think about is how your child is going developmentally. Before introducing food, it's really important that your child has very good head control. So if you sit them up, they should be able to hold their head up by themselves. The reason for this is so that they have a safe swallow and that their head isn't moving around the place when they're trying to eat. Now the next thing to note is that the child needs to be interested in food. If a child's not quite ready to introduce food, you might notice that they push their tongue out and they're not interested in taking the food. Once they start looking at food, see you preparing food and show some interest in what other people are eating, and they don't stick their tongue out when you try and offer them food, then you know they're ready. Now this doesn't always correspond with the parent being ready because it can be quite a big step. So make sure that you're both comfortable before you go ahead. So what food can you introduce to your child first? It can really be anything soft. Now traditionally people have introduced rice cereal, but something like a vegetable puree or even some fruit that is pureed can be very well tolerated as the first foods. A lot of people are leaning towards what we call baby-led weaning, which is where children have more autonomy and they can actually hold food with their hand and eat. If a child doesn't have teeth, gnawing on hard sticks of food is a good way to start baby-led weaning. So things like celery sticks or sticks of carrot that they can just chew on, mostly for fun. If you'd like them to eat some sticks of food, they need to be really soft and easily mushable between your fingers. Now, choking is a big parental concern with starting foods, particularly with baby-led weaning. The most important thing to note is that a bit of gagging is okay, and in fact, it's actually normal and shows us that the child has a good gag reflex. So you may find that the child gags a little bit and clears their throat and then they're happy and keep going. Choking is more of a concern, and that may look like them struggling to breathe and struggling to get air in. It would be a good idea to have a read up on how to manage choking before you start giving your child food. Essentially, the key to that is back blows, so having the child on your lap and giving them some blows on their back. Other parental concerns with starting solids include nutrition. Now, a lot of children under 1 may eat very little food. Some eat a lot and some eat hardly anything, and nutrition is a big concern for parents. The main thing to note is that less than 1 year of age, children mostly rely on milk for their nutrition, whether it be breast milk or formula. So don't be overly concerned about nutrition, but just be aware of it. As long as your child is growing and putting on weight and developing normally, then the amount of food they're eating under the age of 1 is fine. But of course, if you're worried, you should speak to your GP or your maternal child health nurse. Fussiness is also a big concern for parents, and it's important to get in some good habits early. We will chat about this with the Wholesome Doctor shortly. And finally, allergies really concern parents with introducing food. The main message that I want to talk about right now, before I speak about allergies in more detail, is that early introduction of allergenic food is the most important thing for your child in terms of reducing the risk of allergies later on. And I'll talk a bit more about the allergenic food shortly. So the main thing with introducing foods is go at your own pace, have fun, be prepared for mess, be prepared for good days and bad days. It's not going to be an easy, straight line with introducing foods into your child, but it is a really, really important step for their development and for how they see food going forward. And seek help if you're having any trouble at all. I am really excited to chat to our next guest, the Wholesome Doctor. Dr Preeya Alexander is a GP and a mum of 2 who advocates for a healthy yet realistic lifestyle and promotes preventative medicine. Here to share some of her pearls of wisdom is Dr. Preeya.
Thank you.
I'm so excited to have you on.
I'm excited to have a chat to you today. This is an awesome idea, so I've been looking forward to this.
Great. Now, I love everything about what the Wholesome Doctor stands for. Can you tell us a bit about how you came up with this concept and why is it so important?
So I came up with this concept in 2016, which seems like a completely different world and lifetime ago. But I came up with the concept because I was essentially kind of quite exhausted by the amount of health misinformation I was seeing on social media. And I think, people watching can probably, relate to that. You kind of see a lot of health myths being widely spread. And so in 2016, I thought enough is enough. And I thought I'm going to get out there and kind of try and combat that misinformation and try and improve health literacy in a fun and engaging manner. And so that's how the Wholesome Doctor was born, my Instagram and my blog. And it's kind of, taken on a life of its own now. It's taken a good 4 years of hard work, but yeah, it's hopefully finally getting somewhere.
That is such a wonderful idea, Preeya, and I'm so glad that you're doing this. Now, let's just jump straight into it. Introducing solids is such a massive part of children's and parents' lives. There is so much information out there, like you just alluded to, and obviously different things work for different families. But what is your general approach to introducing solids?
Yeah, I think general approach is probably the right term there, because I think it's important to say to parents there's not one single right and best way to do solids. And I think that's what kind of, freaks out particularly first-time parents, where they think, oh my goodness, there's a rule book and I need to follow it. Look, there are some rules, no whole nuts for infants because of the choke risk, making sure when you introduce things like egg, making sure they're cooked through so that you reduce the risk of things like salmonella. But, I say to my patients, a lot of it is actually quite grey, and you can choose how you want to take your child and your family on this journey. So the first thing is with introducing solids is, when to start. And so the guidelines generally recommend now, 4 to 6 months, usually around 6 months. And, the recommendation is basically wait till your infant is ready. And I say to parents, don't start competing with the other parents in the parents group or the virtual parents group, which might be happening now. Don't compete with friends. Don't listen to other people when they said they started solids. Read your infant. And there are signs of readiness for starting solids. And it's things like, kids need to have good head control. They need to, be quite interested in food, either watching you eat or suddenly spontaneously opening their mouth to a spoon. So you really want to look for those signs of readiness. And then you want to basically start the journey. And I think people are quite reluctant. They kind of don't know where to start. Do we start with the baby rice cereal? Do you start with avocado? Do you start with mashed banana? Truth is, it probably doesn't actually matter as long as you start. And I think some people are so cautious and reluctant that they don't actually start. And then we know the consequences of that, Nelu, which is things like iron deficiency, because you don't start getting iron through the diet. But, I say to patients, start, choose something you feel safe with. And as long as you're starting, you're doing the right thing. And then I talk about, introducing allergy foods, introducing iron-rich foods, and how to kind of do that.
Oh, that's all fantastic advice. We'll just reiterate that allergy foods before 12 months is the recommendation, which we are both very passionate about.
We absolutely are. And I think it's important to say to people, it's okay to be nervous before you introduce the allergy foods, which is stuff like, peanut, tree nuts, cow's milk, egg. There are others. But, people kind of go, oh, I know those foods can often cause allergy. And so they're kind of, reluctant to introduce them. And we know that actually delaying the introduction of those foods can increase the risk of food allergy. So get them in before 12 months. And once you start them, please keep giving them, because, just doing them once and seeing no allergic reaction isn't enough. You've got to keep them in the child's diet to reduce the risk of food allergy.
Oh, that's fantastic advice, Preeya. Now, as a GP, what are some of the common foods or food-related issues that you see parents come in with?
GPs are kind of the front line for the kind of, everyday food stuff that parents and families are battling at home. And so the common things I tend to see are fussy eating, big one. So, kids who will literally not touch certain colours, who will just want to eat plain pasta. There is a spectrum of fussy eating. There is, what I call kind of, the everyday fussy eaters. And then you can get kind of with autism spectrum disorder, some really, rigid food behaviours and not liking certain sauces or liking things being mixed in colours and things. And so, paediatricians, dietitians, are heavily involved there. I see a lot of constipated kids, which is often very much, dietary related. When you actually go into how much fluid and water is the child drinking, how much fibre is going into the diet, it's usually a big dietary component there. And I see, kids with nutritional deficiencies. So, iron deficiency would be one of the most common ones, and that's often, dietary related, which, can often be there's too much cow's milk going in after 12 months of age, or there's simply not enough iron going into the diet. So those are the common things I tend to see when it comes to kids and diet.
Gosh, they're all really important things. And I guess there must be so many parents out there who are just feeling at a loss, because getting food into kids can be really tricky. And I've actually have just received your book, The Rainbow Plate, which I ordered online. This is such a fun way to not just get kids talking or thinking about fruit and veggies, but to get them actually enjoying it and wanting to eat it, which I think is really amazing. So hats off to you for that. Love it.
Thank you. And I think it's important to say to people, Nelu, that it's okay for mealtime to not be easy. I've written that kids book. I'm constantly talking about getting veggies and fruit into kids, on my social media. My kid eats really well, both of them do, but please know that I have tough days where I go, you need to eat the kind of the sauce of the pasta, or you need to eat some of the rainbows. So I have tough moments too. Please don't think it's a walk in the park. But, the book is basically a way that I've made it fun, because I know from experience as a parent and as a GP, when you say to your kid, you need to eat all the carrots and all the peas before you have anything else, it can be a battle. So it's worked with patients and it's worked with my kids. So, yeah, fingers crossed it works with yours.
Yes, I can't wait to read this to my little along those lines, apart from what you've just discussed, is there any other advice you can give to parents who might be struggling to get food into their kids?
Number one, role model. Kids ideally need to be eating the same stuff as parents. It's no good you saying to them, you need to eat the veggie pack stir fry, but I'm going to have the pepperoni pizza. That's not kind of fair. So, we do mealtime together as a family. So I eat at 5 p.m. It's the best thing ever with the children. I eat the same thing. And so it's simple role modeling. And the other thing is involving your kids in mealtime, in food prep if you can. My daughter is involved in every step of prepping meals if I have the patience to have her in the kitchen with me. But it just means that she's part of the process. And then when the meal comes out, she goes, I stirred these rainbows in, and I was the one who put the carrots into the meal. Make it less about you need to eat this, but more about who can get the most rainbows into the pita pocket. Let them have fun and feel the food and play with the food, and taking the kind of pressure out of mealtime and you need to get this in. It has been a really helpful tip with a lot of my patients.
I really love that you're making mealtime more about the experience rather than getting the actual food in. And I think that's the key. It's actually the key with a lot of parenting and things with children, isn't it? So where can we find you if anyone's interested to follow the Wholesome Doctor?
So I'm at the Wholesome Doctor on Instagram, which is where I tend to do all my kind of, sharing my recipes and everyday life and health tidbits. And I have a blog associated with that. And you can also get the book from the link on the Wholesome Doctor.
Amazing. Thank you so much, Preeya. And thanks for all of your advice.
Thanks, Nelu.
Now, allergic reactions is something that we see a lot in children. And it's not always just about food. So I want to chat a little bit about that. An allergic reaction is essentially the immune system reacting to something foreign. And there are different types of allergy. There's allergic reactions that happen immediately with the big hives and welts and swelling, sometimes the difficulty breathing. There are delayed allergic reactions that happen with vomiting that might happen 2 hours or so after ingestion. There are other allergies to foods, pollens, grass, medication, and all sorts of other things. Now, the most common allergy we see is allergy to food. The most allergenic foods are eggs, peanuts, tree nuts, cow's milk, soy, wheat, fish, and shellfish. Overall, they are the most common foods that cause allergy, and they are the ones that, as I mentioned, should be introduced as soon as possible, ideally before the age of 1, to reduce the risk of allergy. So what does allergy look like? So there's mild allergy, and usually with that we see the hives, which are the big welts that are raised and can be quite itchy. Swelling, usually of the face and sometimes of the tongue as well. Vomiting, diarrhea as well is quite common with mild allergy. So the way I like to think about it with severe allergy is that's more the internal organs. So the airway, for example, and that can be wheezing, noisy breathing, or any difficulty breathing, swelling of the tongue or swelling in the throat that sometimes children can describe, collapse, pale, being dizzy as well. So that can show heart involvement with the allergy. So if there's any concern about heart or lungs or breathing, that automatically makes it a severe allergy. So what can you do if you suspect that your child has had an allergic reaction? If it's mild, so rash, swelling of the face only, or vomiting and diarrhea, then that's counted as a mild allergy, and antihistamines can be very helpful. So it's not a bad idea to have some around at home, particularly when you're introducing foods. The other thing is, if it settles down, try and have a think about what the trigger could have been. Was it a food, or was it a pet? Was there something that happened that day that might have brought this on? Often viruses can cause the same hives rash as well, so thinking about what the trigger is and then going and seeing your doctor. If you're convinced that it might be food related, it's a good idea to stop that food that you think may have caused the allergy. However, it's very important to continue all other foods that your child has already eaten without concern. We see a lot of parents who stop groups of food after a potential allergic reaction, and that can actually make allergic reactions worse later on. Now, if your child has a severe allergic reaction, so concern about breathing or collapse or dizziness, that's an urgent call to 000. The ambulance have medication called adrenaline, which is very important for reversing allergic reactions. If you know that your child has an allergy and they carry an EpiPen, this would be the time to administer it. Often these children end up in hospital for a period of observation, and then we need to have a think about what's caused it. Again, it's mostly food, but it could be other things as well, and sometimes it happens with no real cause, but often you'll end up seeing an allergist or immunologist about that. Now, a few parental tips that I wanted to chat about, because there are a lot of myths and misinformation out there about allergies. The first thing, as mentioned, if you're worried about an allergy, stop that food but continue giving all other foods that they've already had. So for example, if a child's had a peanut allergy but has already eaten other types of nuts, keep giving those other nuts. Don't suddenly stop all nuts, just stop the one that they've had the reaction to. The next thing to note is that allergy in general doesn't cause eczema. Some foods can trigger eczema, but it doesn't actually cause eczema. It usually flares up eczema in a child who already has it. If the eczema is the only symptom after the food, so they've got no other signs of allergy, then clear the eczema, work on the skin, and then try introduce the food again. The last thing that I really want to mention when talking about allergies is that children with asthma have a higher risk of having a very severe allergic reaction. So the children that do really badly with allergy are usually the teenagers with poorly controlled asthma. So what that means is they're not taking their regular medication, they don't get on top of their asthma attacks as quickly as they should. It's really important that any child with asthma and allergies really takes care of their asthma and takes their EpiPen everywhere they go if they're prescribed one. Allergy is a really complex and confusing area of medicine and pediatrics. There's a lot of resources out there for parents who have questions. My favourites are the ASCIA website and preventallergies.org.au website. There's a whole host of information there. Make sure you're getting your information from reputable sources because managing allergy early is crucial for children. Okay, so today joining us, we have a very special guest and his name is Rav. Rav, welcome to the show. Thank you so much for joining me.
Hi.
Hi. Rav, how old are you?
4.
You're 4. How old do you think I am?
5.
Not bad, not a bad guess. Rav, do you know what I do for work? I am a doctor. Do you know what a doctor does?
It helps sick babies.
Yeah. Do you know any doctors?
Yeah.
Who do you know who's a doctor?
Mommy.
Your mummy. So what does your mummy do at work?
Look after sick babies.
Yeah, does she do anything else?
Cooking.
Yeah, that's I'm sure your mum does very good cooking. So when did you go to the doctor last?
When I was 3.
When you were 3? What happened when you were 3?
First, I had the appointment and then I got ill.
So Rav, in today's episode of my show, we're chatting about food and allergies. Do you know what an allergy is?
We'll get sick.
Yeah, so when you can't have something and then you have it and you get sick, that's a really good way of explaining it, Rav. Do you know anyone who has an allergy?
My friend.
Oh, what happened to your friend?
She can't have sweets.
Oh, what happens when she has sweets?
She might get sick.
Are you allowed to have sweets?
Yeah.
What's your favorite sweet?
Chocolate.
Oh, me too. High five over the phone, over the camera. Rav, do you have any questions that you want to ask me?
Why did the allergy happen?
Oh, that's a very good question, Rav. It's because there are things in our body that just don't like certain foods or medicines. And then it makes us have a reaction. What's your favorite food, Rav?
Carrot and broccoli.
Carrots and broccoli. Oh, aren't you a good boy? Is that your actual favorite food? Or are there other foods that you like?
Apple.
What's the difference between a healthy food and an unhealthy food?
Some kind of food are healthy and some kind of food aren't.
So why do we eat healthy food?
To make us strong.
What are some healthy foods you can think of?
Banana.
Yeah, bananas are very healthy. What else?
Chicken.
Like chicken? Yeah.
Rav, what sort of medicine do you take?
Vitamin D.
Vitamin D. Do you know what that's for?
Our eyes.
And how do you take your vitamin D?
By going outside.
Oh, have you ever had to take any other medicine before?
A different kind of vitamin D.
Okay.
That we keep in my bathroom drawer.
Ah, that is a different vitamin D. And how do you take that vitamin D?
We have to put our mouth up and then it comes dropping into our mouth.
Oh, and are you good with taking it?
Yeah.
What would you like to tell all the other kids watching if they're a little bit scared of taking medicine?
Tell them that medicine's good for you, and if they take it, you feel better.
Oh, I love that. Thank you so much for chatting with me today.
Bye, Dr. Nelu.
I love it. I love it. And that's about it for today's show. Thank you so much for joining me. If you'd like to watch this video and more, head to Channel 31's YouTube channel. See you next time.